Did you know that approximately 60% of people will experience a nosebleed at some point in their lives? Indeed, epistaxis or nosebleed is not just a common occurrence, it's almost a universal one. It happens when the delicate blood vessels inside the nose rupture. Now, why does this happen? There are myriad reasons someone might find themselves reaching for a tissue to stem a sudden flow from the nostrils. First and foremost, dry air plays a significant role. When the nasal membranes dry out, they are more susceptible to bleeding. This is particularly common in winter months when indoor heating systems are in use. Another frequent culprit is trauma to the nose. This could be anything from a sports injury to a child's innocent but forceful exploration of their nasal passages. Similarly, allergies and sinus infections can inflame and irritate the nasal membranes, making them more prone to bleeding. Medical conditions also factor into the equation. High blood pressure can increase the likelihood of a nosebleed, as can blood clotting disorders, which might prevent blood from coagulating normally. Furthermore, certain medications, particularly blood thinners, can exacerbate the risk of epistaxis. When it comes to managing a nosebleed, the steps are straightforward yet crucial. One should sit upright and lean forward. This position helps prevent the blood from flowing down the throat, which can lead to coughing or choking. Pinching the nostrils shut for a few minutes often helps in applying necessary pressure to stop the bleeding. Applying ice on the bridge of the nose can also be beneficial, as the cold helps constrict the blood vessels, reducing blood flow. For those who find themselves with a more severe case, medical intervention might be needed. Treatments range from cauterization, where a doctor uses a special solution or a heated device to seal the bleeding blood vessels, to more advanced procedures like nasal packing, where gauze or a balloon is inserted to apply pressure and stem the bleeding. In cases where bleeding is recurrent and severe, surgical options such as septoplasty or artery ligation might be considered. In summary, while a nosebleed can be a startling event, understanding its causes and knowing how to effectively manage it can make a significant difference. Whether it's taking preventative measures like humidifying your home or knowing how to safely stop the bleed, being informed is your best defense against epistaxis. Remember, if nosebleeds become frequent or severe, consulting a healthcare professional is always advised to rule out any underlying conditions.